and no windows, you'll be happy to know there are lots and lots of windows. So thank you. I'm so excited to welcome you here today for our annual meeting and for a very important discussion about the mental health crisis that is facing young people on Long Island. I'm going to talk today about an insidious thief. And let's start with an agreement. A thief, a person who robs your home, your school, or your community must be neutralized. All resources must be concentrated to protect our families and schools and communities, right? The impetus behind today's meeting is the constant and continuous crisis that I hear from each of you, from all of your agencies, about the lack of infrastructure and the children that aren't being seen, that are living invisibly, that consequently stop seeing themselves. These children may be kids who are living in fear from the extraordinary trauma associated with their journey to the United States. Long Island has absorbed almost 11,000 of these children since 2014 with no statewide regional educational investment. They need support, but where do they go? Where do their school systems go when there is no statewide investment? First off, what is the message? Is one child's life more precious than another, more valuable than another? Or perhaps today we are talking about children that are struggling with depression or anxiety. According to the CDC, 1 in 5 children either currently or at some point during their life have had a seriously debilitating mental illness. Let that sink in. According to the World Health Organization, depression is the leading cause of disability worldwide and is a major contributor to our global burden of disease. We routinely teach children to identify their stomach aches and their colds and give them language to express their pain. We even teach health in our schools. We have no system of education for symptoms related to an illness so common that 1 in 5 Americans will experience mental illness in a given year. Not only do we miss the beat on teaching children about symptoms and what to do with scary or difficult feelings, we also fail to train our educators and folks working with children to understand that behavior is a language. And that when we simply stifle that language, when we punish the communication tool that the child is using, we miss the opportunity to climb into the window of that child's soul and provide the help they need. And I'll never forget my first job out of college. I was an education director in Hempstead, and I got a call one day from a teacher who said a child was throwing chairs in the classroom. She paged me and needed help. And I ran down the hall, and I walked in, and the other children were, on the other side of the room. They were safe. And he was picking up chairs and throwing them. And of course, as an adult, your instinct is to stop something like that so nobody gets hurt. But I stood and observed for a minute. And I got down on my knees, and I asked him, "Who throws chairs?" "Daddy." "Who does Daddy throw chairs at?" "Me and Mommy." And the most unbelievable story of domestic violence came from that one moment of listening to the child's behavior and understanding that he was communicating, that he was trying to tell us that he wasn't okay, and we were able to intervene and support his family. Perhaps today we were talking about children whose early experiences impacted brain development. They grow into adolescence with intense behavior patterns that are unmanageable for their families. Where do families go when they cannot safely and effectively care for their most precious and yet most difficult child? They can't love away their disease. And 1 in 25 Americans live with a serious mental illness like schizophrenia or bipolar disorder. And here's the thing, whether we are talking about the highest income families or the lowest, navigating resources on Long Island is difficult for every family. Mental illness is an equal opportunity phenomenon. It impacts people of every culture, means, and community. Yet it is often a silent thief. It robs children, families, schools, and communities from seeing the promise of our most precious young people realized. It is a cultural thief as well. It steals community connection. It fosters isolation. If a child is diagnosed with a disease like cancer, communities on Long Island rally. GoFundMe pages are started up. Fundraisers are held. Lasagnas and chicken parmesans are delivered to take the stress off of families. We surround each other with love, with support and compassion, as we should. But if a child is hospitalized for a psychotic break, crickets. Silence. Nobody shares it, nobody knows it, and families drift further and further into the abyss of isolation and fear. And it's not just families that make this decision, it's our culture. It's all of us. Let's take ownership today. We simply don't talk about it, and we demonize, even when it comes to access to services. For example, in our schools, if a family tries to get child special education support for a psychological disability, they have to endure the label of emotionally disturbed, or they are dismissed with skepticism, their motives questioned. What parent who loves a child wants to sit in a meeting where their child is labeled in such a way, or experience dismissal of their attempt to help their child? Not to be told how capable and wonderful their child is and how the meeting will focus on helping, but rather to discuss a classification that for so many brings shame and fear. Or to be told that the real problem is in the home or the family, that they are simply not working hard enough for their child. Nobody blames the parent when a child has a type 1 diagnosis of diabetes at age 12, but a diagnosis of major depression, often it's a different story. Mental illness in a child is so often seen as an explicit failure on behalf of parents. And it's not infrequent that children with mental illness are labeled as behavior problems rather than deserving and in need of care. Mental illness is a thief that robs families of hope and opportunity, but so are our systems. I really believe that we are living as a society in such fear of one another, where demonization of people who are in pain and struggle occurs regularly instead of confronting the broken systems that result in the mass shootings that we're seeing, or local violence, in the recent case of a child who was murdered in Oceanside, or the suicide, the most recent suicide in Rockville Center, or the absolute failure to thrive that so many students in Hempstead are tracked for before entering pre-K every day. And when I speak of Hempstead, let's remember that we are America's first suburb, for which we can feel pride, but we were developed with exclusionary principles that continue today to make us one of the most segregated regions nationally. I often wonder, as much as I love Long Island, and as much as I love Long Islanders, how many more generations of crisis are we going to continue to be complicit in observing? How can we see the inequity? How can we see one another and not act? How can we be complicit? And when we say the system is broken and we don't act to change it, we are complicit. And let's remember, as we're talking about mental illness and crisis in families, that when families of color reach out for help, they are far more likely to end up in another system. Child Protective Services, for example, is a lot more likely to be called. Asking for help can quite literally bring more pain when systems are created without humanity as its core value, as its central tenet in a region that is as segregated and inequitable as ours. We weaponize the notion of mental illness with our language too. Why do we create an us versus them dynamic when we are talking about all of us? Rather than recognize that those suffering are more likely to be victims than perpetrators, we talk about other human beings in our culture, in our media, and in our conversations with one another as crazy, as off, as not suffering from mental illness, but rather being the illness. We take away their humanity in our systems and our language. We don't say this is an exceptional person with a series of symptoms that have collectively become known in our culture as depression or bipolar disorder. We say this mentally ill person. We replace their humanity with a label, and we create so much harm when we do. We rob them of their humanity. We miss the opportunity to see their humanness reflected in us and ours in them. But today we will confront that. Long Island is fragmented. We have 2 counties, 13 towns, 95 incorporated villages, 124 school districts, and I could go on and on. Our fragmented system fails all families, but those in need disproportionately. Imagine a parent trying to access services. Where do you go? How do you even begin? Over 125,000 Long Islanders don't even have health insurance, and many more are underinsured. Imagine the stress of needing care for your child and feeling that it is outside your reach. I mean, just stop and think of your own child for a moment, or a child in your life that you love. Imagine that pain. Wow. And I know many of you in the room aren't imagining because you've been there and have probably grieved your family's hopes and dreams in private. There is no unified, cohesive health and human services system on Long Island. Services are, for the most part, provided piecemeal between counties, towns, schools, health centers, and agencies. Sometimes families in need aren't lucky enough to even find a psychologist or a doctor. And so often, when a family has success in meeting their needs, it's determined by the person on the other end of the call, at the other end of a referral who answers the phone, and how motivated they are to navigate the maze of services. And just think about what that means for a moment. You're a mom, you're a dad, you're a grandparent, you're a step-parent, and you get the courage. And believe me, it takes courage to pick up the phone and call for help. In that moment, it feels like your entire survival as a parent and as a family system is dependent on the person who answers the phone. You feel powerless, you feel desperate, and that system, it robs. A system that doesn't put families first and isn't set up to help robs people in their darkest moments from the sacred space of being seen, being recognized, and being helped. And not only do families and individuals fall through the cracks with their needs unmet, families are often traumatized by the very human service system, or lack of a system, that is trying so hard to serve them. In the last 3 months, some of the people that we've helped include a dad who had no cultural context for mental illness when he had to revive her daughter after she took a bottle of pills in a suicide attempt. And then because she was 19 years old, had the power to deny him access to help her navigate her treatment with her doctors. It included a mom so scared for her daughter whose addictions and complex psychosis seemed to appear suddenly after an otherwise normal childhood. And it included an aunt whose niece was diagnosed with a serious mental illness that rendered her afraid to attend school. And rather than absorb this family, the school district used this as an opportunity to reinforce truancy and attendance rules. And at the Health and Welfare Council of Long Island, historically, our most common call has been the need for affordable housing. And that has been replaced with the need for families in desperate shape to access care for their children who are suffering from mental illness. If a community's potential on Long Island is limited, yours and mine is too. If people are unable to access treatment or care for any reason, who suffers? Individuals and families, yes, but also schools and entire communities. Do you know that a little over 3,500 Long Islanders are in New York State jails or prisons on any given day? And about 25,000 people are being held in jails across our state? It's robbing our children of a bright future. You cannot convince me that 3,500 Long Islanders can, on any given day, have no potential and no capacity. But you can convince me that through continuous systems failures and missed opportunities for treatment, they have lost their hope. And losing one's hope may be one of the most darkest nights of the soul, the most vicious of human experiences. We have to start thinking creatively about making the space to neutralize conversations about mental health from being in the context of shame to being in the context of hope. We have to do it in our homes, in our workplaces, our faith-based institutions, and our schools. Because our communities aren't just losing their hope, they're losing their humanity and inherently therein their lives. And I mean that literally, when the suicide rate among adolescents is the highest it's been since the year 2000. Let that sink in. And yet in New York State, there still aren't state-mandated requirements for-profit managed care organizations that ensure true mental health parity and improve network adequacy. We must look at our practices with a renewed vision, one that says children have rights, one that says children matter, one that says we believe that rehabilitation is possible, that individual lives have hope. Because as it stands, managed care organizations engage in medical necessity reviews every 3 to 7 days when a person accesses residential care. Imagine the unbelievable effort for a family in getting their loved one in care and the incredible courage of a person who's struggling. And imagine you get where you need to go and you're all set up to get treatment, and the minute you arrive, the facility has to start considering discharge planning because your for-profit managed care company's goal is to step you down and get you out of care. Where's the humanity in that? I'll tell you where it is, it's out the window. There is also no humanity in a family court system where a reunification model means that psychological safety is rarely considered and children are forced into visitation with people who hurt them, which can create lifelong damage. We have to do better. If we don't, we remain at risk for using our institutions, our courts, our protective services to increase harm and to literally catalyze mental illness. Our institutions and our laws have to be revisited with the valuing of all humanity at their core. The idea that intervention can only occur when a person is a danger to themselves or others, and that this only means being suicidal or homicidal, means that people who can't take care of themselves adequately or suffer from severe addictions are left in the cold, dark emptiness of life to battle on their own. I started my remarks talking about mental illness as a thief, one that robs families and communities and schools of harnessing the light that is in every child. Well, we cannot stop this thief from robbing our future if we don't unmask it, if we don't confront it, and if we don't see it. The time is now. The sense of urgency couldn't be greater. We are literally fighting for the souls of our region, for the sustainability and hope of our future. So please join me today in believing that we have a historic crisis of consciousness, not a lack of expertise or creativity to solve the challenges we face. The brainpower in this room could devise systems and information exchanges and community cultures that transcend this crisis that our children on Long Island are facing. Yes, there is bureaucracy, and yes, it's hard to make real change. But the psychologists in this room, the community agencies that provide services, the parents, the people who care about all children, we know we can't wait anymore. That's why you're all here. Albert Einstein once said, "The world as we have created it is a process of our thinking. It cannot be changed without changing our thinking." Join me in listening to this extraordinary panel today and changing our thinking and transforming our systems. And let's harness the collective power in this room to return childhood to our children, hope to our families, and prosperity.